going to be talking about workplace wellness. And we have 3 guests as our panelists today: Meggen Brown, Felix Lee, and Greg Ryder. And instead of me introducing everyone as I have been, I think it would be nice to have each individual say a little about themselves and introduce themselves. So Meggen?
Good morning, good afternoon to some. Thank you for having me. My name is Meggen Brown. I am a nursing leader, currently the Chief Nursing Officer for Kroger Health. Many know Kroger as one of the largest retail grocery stores in America. We have multiple different banners that we sit under, such as Dillon's, Harris Teeter, Fry's, King Soopers, and many more. So I today currently work under our Kroger Health pillar and oversee all of our clinics, work with our pharmacy teams, our specialty pharmacy, as well as our Kroger prescription plan. Felix?
Hi, hello everybody. So my name is Felix Lee. I'm currently the head of medical for digital healthcare in the US for Sanofi. And I come from I'm a pharmacist by background. And I come from a background of working in innovations across business models, partnerships, pharmaceutical products, and also digital health in terms of digital health services. And in recent years in digital health, I've been more focused on the patient-facing digital solutions that help improve the management of chronic conditions. And we have a collaboration with a company called Dario Health, which is a chronic disease management platform, multi-condition, that are made available through employers and health plans in the US.
Everyone, Greg Ryder, glad to be here. I'm currently Director of Corporate Compliance for Emblem Health, which is a regional health plan here based in New York City. I've been in the healthcare industry for many years, primarily in the training field. I've worked for medical education agencies, pharma, worked for NYU Langone Health before I came to Emblem Health. And I started our LGBTQ employee resource group, also an LGBTQ health coalition for health providers and social service agencies within the New York area, started our DEI council. And I'm particularly interested recently in how we can look at mindfulness, our storytelling, diversity, clinical education, health equity, how all those things can combine together to really help advance health results and make sure that all of our populations are served in the way that they need to be served.
Well, thank you. So I've been very excited to have this conversation because to me, it's really refreshing to see corporations, small companies, large companies, corporations, placing more emphasis on not just healthcare benefits, but holistic care for their employees, thinking about mental health, mindfulness, well-being, work-life balance. So I'm excited to have this conversation, and I'd like to start my first question with you, Meggen. So Kroger aspires to have the healthiest workforce in America. How is the company addressing and supporting holistic health amid emerging from the COVID pandemic?
So having the healthiest workforce in America is a pretty, vivacious goal that we have. But the first thing that we had to do at Kroger is understand that the care delivery and the quality of care starts with our own associates, our own providers first. So in order for them to push that out into the communities, how can we make sure that they're their best self? So that doesn't just include physical health, but it also includes emotional and financial well-being as well. So we're really cultivating an environment where everyone can find an opportunity to thrive, whether it is we tell people that they come for a job, but stay for a career. And how do we do that? So one of the multiple digital tools that we're currently using with our over 440,000 associates that we have today, and 24,000 of those are providers themselves, we use a well-being associate resource called Meggen. So, and that's not just for our associates, but also, even if you don't take benefits from us, we also help with the associates' family members if they are directly connected with them. So, because at times it can be taking care of somebody else or helping that. We also use Lyra Health, which can help with stress, anger, any kind of anxiety issues as well. Goldman Sachs, ACO Financial, is a great financial tool because it's stressful, today, and the economy is very stressful. So we use that. We also have one of the ones that I like the most and have personally used is our virtual physical therapy called Hinge. So a lot of people, they don't want to be out and about. They want to be, home and from the comfort of their home to focus on their well-being. So Hinge is a resource that we use for physical therapy. We also have, we wouldn't be a grocery retailer if we didn't have our dietitians. So food is at the core of everything that we do. So we have virtual telenutrition dietitians across 48 different states that you can call in. They can go shopping with you. They can help you on your path to a healthier you. Also have providers that are virtually and pharmacists as well that can help from your basic needs, from mental health and emotional health to you have an acute illness, and it's just an easy, accessible way to get to a provider. And the last thing that I feel is very, very important, and I think Greg's going to touch on it a little bit, is associate resource groups, different ARGs. We have over 101 different associate resource groups that are powered by our associates to feel a sense of belonging as well.
That's great. And since you've raised this, I'm going to skip around the agenda just a little bit. But yeah, we call them ERGs, or employee resource groups, in our organization, and they have been super helpful in a variety of ways to help drive change across the organization, as well as supporting the work that we do. But Greg, can you discuss the role of these ERGs and diversity, equity, and inclusion programs in promoting employee wellness, and any successes that you have seen or could share with us?
Yes, thank you, Amy. Definitely employee resource groups, since their sort of beginning back in the early 80s, they've evolved, and they were originally sort of developed as opportunities for like-minded employees just to connect, to identify, and to share experiences and stories, and that's where the traditional term is affinity group. They've then evolved into business resource groups, and now some of them called employee resource groups. But whether it's a BRG or an ERG, they're really about some of that connection, some of that identification, but it's how can they partner with the company to bring about business results. I was particularly struck by Paul's information earlier this morning, and he shared some very sobering results about health equity. These ERGs can help you leverage what you need to do in those underserved populations. I was thinking about some of the apps that were discussed this morning. Even when you're testing different iterations, rollouts of AI technology, use your employee resource groups to test that information. In the example where there really isn't as much diversity in clinical trial populations as there should be, use your employee resource group. They've got connections with the BIPOC communities, with Latinx, with AAPI, with LGBTQ, Native American, women. Use them to foster their connections to help you reach your goals, because you obviously just can't have all the senior leaders try to meet all those needs, nor should they try to. The other interesting thing is that on a number of surveys, employee engagement surveys is sort of a big tool right now that a lot of companies are using. Those employees that are involved with ERGs, whether at a leadership level or just as an active member, they have much higher employee engagement scores than your employee population at large. So there's value there. They're more likely to recommend your company as a good place to work. Or if there are issues, they're more likely to speak up. And if you've got leadership that is truly interested in listening to what they have to say, not just sort of, oh, nice, yes, we'll invite you to a meeting, tell us how wonderful we are, but really, what do we need to know? They're a valuable resource. I've talked about a healthcare coalition. Some of the things that the employee resource groups at Emblem Health did, they helped to sort of foster a diabetes prevention program among BIPOC communities. They had something where this is sort of lighthearted, but it helps with stress and employee wellness. Our Melting Pot, which is our group for AIPI, they invited people to participate in a virtual tea sampling, and so people could sign up. They got a package of different types of teas that were mailed to their home, and then they all participated in a Zoom webinar where they talked about the values and the types of different teas and how they can help you. And I don't know about you, but I'm all for anything that can help bring calmness and mindfulness to my workday. So those are just some ways that ERGs can really bring value and help to put real mindful and real impactful initiatives, not just around DEI and health equity, but all of your business goals and objectives and needs.
Yeah, I think it's great to see, as you said early on, their original purpose was really just an affinity connection group, and now they're really driving change in the organization. So it's nice to see that. So thank you. So Felix, I'd like to ask you, based on your role in the digital health space, how can employer-sponsored digital health solutions help improve well-being?
Yeah, so thank you for the question, Amy. So I think before I started in the digital health space, my traditional thinking was, employee benefits are okay, ultimately to improve productivity of employees. And I think in recent years, it's really struck me, what it means really to think about the employee experience. And then, having employee satisfaction as a measure of that engagement, et cetera. And I think to Meggen's point earlier, the purpose of, having these different offerings for employees, ends up, it's not only around, financial outcomes, but also emotional and physical outcomes. And so, today when I was thinking about this panel, so the collaboration that we have with Dario Health, which is a multi-condition platform offering, an app-based solution with connected devices for diabetes, hypertension, weight management, musculoskeletal pain, and behavioral health. And one of the things that they have done a few months ago was to partner up with Arizona and Employee Benefit News to run a survey of employers of what they look for, what their organizations look for with employee benefits of health and well-being. And 91% actually said that what they look for, 91% is looking at boosting employee satisfaction and morale. And things like healthcare and clinical outcomes is really more secondary to that. And so, and part of the survey also asked about employers, do you focus on also your highest cost members? And surprisingly, it's less than 30%. Are focused on high-cost members, and so therefore it really speaks to the fact that companies are not really putting all these together, just for a financial benefit. I mean, ultimately there are going to be direct costs and indirect costs involved, but it really speaks to what is driving the employers when they put these together. And the survey also told us that the vast majority, the most popular offerings are around things like primary care, mental health, these things before coming to more disease-specific or chronic condition-specific ones like women's health or diabetes, etc.
That's great, and I can't help but think the more organizations offer these types of support and resources, the more loyalty you're going to have and more consistency you're going to have in your employee base. So that's great. So Meggen, thinking about the burnout that we see on the clinician side and in the provider side, in the space that Kroger's in, where you're playing a role in that area, can you talk about, Kroger Health being a part of this critical infrastructure, and many of the associates that you have are on the front lines serving customers and patients through a pandemic, and also now with just increased demand and flu seasons going on. How are you supporting those members of your team?
Listening. That is the number one focus that we have because, step back to 2020, as a nurse practitioner myself, we went from heroes to zeros real quick. So where we were out front and we were helping, others, live their healthiest day to day and really being forefront of the pandemic, our providers, pharmacists, nurse practitioners, physician assistants, our MDs, they didn't get a break. So we really had to step back as a leadership team and say, how can we differentiate ourselves? How can we help people continue to thrive and not leave the profession? So we've done a lot of things with associate insight surveys. So we send out an associate insight survey. But the thing is you can't have an associate insight survey without doing something with it. A lot of big companies make that mistake of sending out a survey and then you don't ever hear any feedback. So truly listening, diving in, forming groups and different resource groups on how we can get better is one of the number one things we do. We do that on a yearly basis, but we also have pulse surveys that we send out to the groups. And one of the things that the company has really invested in the last year is we are funding our managers to have group sessions, really socializing, whether it is a group meeting on a Sunday after work or paying for somebody to go bowling with their team, et cetera. That's what they wanted. It wasn't all about the bottom dollar. Yes, we all, work to live. But, the big piece was people just want to say, attaboy, good job, or I see you, I hear you, I know that you're still here. So we've really, like I said, taken a step back, taken those surveys, listened to our people, and put focus on what really matters. We may not think that it matters at the top many times, but if our associates are telling us that, then we need to listen and we need to provide that feedback back to them in a meaningful, useful way.
That's great. Yeah, I think the pulse surveys are, again, a great measurement of effectiveness. But again, when it comes to measuring effectiveness, we talked a little bit about different e-voice surveys and pulse surveys. But Felix, how are you anything else on top of that to measure the effectiveness of some of these offerings and resources, whether they're digital or more traditional?
Yeah. So in the same survey that was conducted, 56% they want to measure defined ROI and measures, but at the same time, everybody has an array of different measures that they want to track. I think one of the most common ones is going to be employee satisfaction, but also there is employee attrition rate, retention rate, and also engagement on into some of the specific digital apps if these are the things that are on offer, or maybe engagement into ERG groups, for example. And so I think these kinds of things, obviously some of that will end up having some direct costs linked to it that people can also measure as part of that. But there's also a lot of indirect costs related to things like retraining and related to attrition and replacement hires, etc. That not necessarily directly related to something that supports health and well-being that you may directly measure a cost saving in terms of the healthcare medical costs that are being paid out by the employer. So I think there are the differences between the direct costs and the indirect costs, and also some of those employee experience metrics, I would say. But also I think from the same survey, employers did also say HR departments can't handle having so many benefits and vendors to manage, and so if a vendor, for example, is able to serve multiple purposes with multiple offerings, then that actually reduces the burden on the employer itself.
Yep, absolutely. And I think it's also interesting to see there's a lot more visibility and transparency of understand what the employees want. Again, going back to kind of the ERG piece, Greg, could we talk about the impact of company policies and the effects it has on the wellness of diverse employee demographics? How can we address disparities in wellness programs to ensure inclusivity?
Yes, thank you, Amy. Policies, I think, need to be regularly addressed and revised to match the changing needs of our employees while still honoring sort of the HR, the legal, regulatory aspects of policies. So it's a fine line, and I think truly innovative companies that are committed to employee wellness will commit to finding ways to ensure that their policies find that right balance. So, you know, it starts with things such as making sure that all your policies have gender-neutral language. If you're referring to specific populations or demographics, you know, you should revise them regularly to make sure that you're using current terminology. You know, no offense to my father, but he grew up in a time, and so he's not adverse, and he he mentioned something to me recently about visiting a doctor, and so I think she was nice, she was Oriental, and so we need to make sure that our policy language is updated, and we're using references and terms to employee groups and identities that are current. Things such as family leave, make sure that they're current, they match current best practices, understanding that what a family looks like today is very different from what families looked like in the 1950s or 60s or 70s. So again, achieving the balance of matching what we need to provide with standard best practices that meet legal regulatory requirements. You know, the tone from the top, harnessing technologies, simple things such as, are these policies, are they accessible, you know, online? Can an employee look up something on a policy on their mobile app? Their code of conduct, clinical policies and procedures. Can a physician, along with some of the training that one of the earlier speakers talked about, training physicians how to best use technology, can they access things that they need on the job to help them with a procedure, to help them with a particular issue? And here again, ERGs can help sort of partner with folks on helping to do that. And then just sort of as a guidance for policies and procedures, there are a lot of organizations that can help companies sort of model. One of the ones that focuses on LGBTQ employees is Human Rights Campaign, hrc.org. They have what's called the Corporate Equality Index and the Healthcare Equality Index, where they have a whole list of criteria where companies can apply. They're very robust to be listed as a healthcare leader. And so they have things around LGBTQ patient services and support, you know, policies that are aimed at eliminating bias and sensitivity, have multidisciplinary gender clinics, have capture sexual orientation, gender identity, gender affirmation surgery components in their electronic health records. So that's just one population group. You can use that as a model for all other patient identity population groups, and again, use your employees to help transmit that message, but you need to make sure that you are meeting the needs of your employees and providing best practices. You don't want to sort of say that we're going out into all these different community groups, we're providing best practices for our various populations, but yet you're 5 or 10 years behind with those same practices with your employees. Are you really ensuring that your ERGs have the support that they need? You need to make sure that you're fully in alignment. And maybe that means sort of pulling back a bit to make sure that you're meeting the needs of your internal employees before you start providing too much innovation in the community, because then you're going to have this mismatch and an imbalance. And that will end up with, you know, affecting your employee engagement score, employee retention. People will say this isn't a good place to work because they're happy to spend money on community and our patients and our customers and our consumers, but they're not willing to spend the money on their employees. So you need to make sure that all of those factors and all of those components are in alignment.
I think it goes back to something Meggen said about listening. Got to listen to your teams. So just one last question I want to touch on because I think it's really interesting, and then I do a quick fire to close it out. But Meggen, I wanted to just highlight, you all have an annual Kroger Wellness Festival. Could you just share a little bit about what the vision is there and how it's intended to help people have better health outcomes?
Yeah, so our vision at Kroger, Kroger Health specifically, is to help people live healthier lives. And so about 5 years ago, we had this genius idea. Let's have a festival. And so we had it inside, and it was okay. Now, year 5 just happened in September in Cincinnati, Ohio. It's an outdoor wellness festival where we invite vendors in with their healthy options that we sell inside of our store. And so it's a 2-day, absolutely free event. We had over 200,000 customers that came and had activations at this where we balance on not only emotional well-being, physical well-being, but there's financial well-being. And we have different pillars, whether it's breathe, movement, uplift. And when we bring all these people in, and we have celebrities that are behind this as well. So Dwayne "The Rock" Johnson was there. You could cook with Cameron Diaz, but to show that health is fun. And we really wanted to represent ourselves in that, yeah, we may be saying that we're doing all these things, but let's really showcase what we're doing for our communities that we live in. And we also bring in associates as well. So from one of our associate resource groups, it's called Wellness 180. So they take out a survey and they go across the country to our own employees and ask, what have you done? Whether it is, have been fighting depression and out of that, I quit smoking, I lost 300 pounds, et cetera. But we bring those people in to showcase that, hey, we're here to support you, we're wrapping our arms around you. But the festival is simply amazing. It's one of my favorite things to do. One thing I'm very, very proud of. And so our next one is coming up in September of 2024. But with that, each year, like I said, it gets bigger and bigger, and we have a different focus throughout that time as well. So if anybody's in Cincinnati, Ohio in September, I welcome everybody to come because it's something that most people walk away and they were like, I had no idea what you could do. And we can't do it without our partners. That's the other piece is we have, like I said, multiple vendors, but we can't do this alone. None of us in this room can do this alone. So we also have different digital platforms that we use as well during the events to showcase what we can pull together across the country.
It takes a village.
Yes, it takes a village.
Another theme for the day. Okay, just so a quick fire round a session. I'd love to know from each of you, what are some of the initiatives or practices for wellness in the workplace that you're looking forward to seeing in 2024?
So I can start. More of a holistic approach. I think we've all kind of touched on it a little bit, but really on social and occupational well-being. And what that is really helping thrive. We are fully out of the pandemic, per se, and people are starting to get back to their routines, back to really focusing in on who they are. And so I think that as a country we'll make a mistake of big employees not focusing on that occupational and social well-being because we're all at different aspects. Some people graduated from Columbia University, got into the workforce during COVID. It is completely different than it was 20 years ago, completely different than it was 5 years ago. So we really have to take a pivot to make people feel a part, that they're not just a number, that they are human beings and that we can wrap our arms around them and let them thrive and grow within whatever company that you're in.
Felix?
Yeah, so I think for me, the trend for the trend for employee experience and in using digital health, digital health or wellness solutions, I think it's going to continue to increase. And at the same time, I think it's not just having available these different solutions, but it's also how you engage the employee into using it, because it's great to be in a catalog, but then if nobody makes use of it and then they don't know that it's there, they don't know why they would want it, then obviously then it's not going to be of use. And I think, employers will become even more scrutinizing, in the future about how much they're spending on these and to making sure that the money is well spent, to be targeting on things that we're hearing back from employee surveys, etc. And also to inject a next level of rigor in terms of looking at evidence around, what these health and wellness, solutions and apps, will demonstrate in terms of does it meet, the outcomes that they are purported to meet.
Excellent. And Greg, thank you.
I agree with what Felix and Meggen have just said. I would only add, sort of on a more, sort of a different plane, if you will, is that in addition to those things, I would encourage all of us, particularly if we're in a leadership position, to make sure that we're modeling kindness and grace and giving people the opportunity to make mistakes, to be human. There is a lot of rancor and volatility in our world, and I think we need to ensure that as we work with employees, as we create the space, as we create these tools, that we're also realizing there's a lot of just sort of negative energy that people are carrying, and we need to just sort of be mindful that we're giving people space to sort of process that, hold that, allow for people to deal with that in a way that works for them, that obviously doesn't terribly negatively affect their performance, but that has to be part of the equation. That has to be part of what we're talking about here, and just make sure that we're just acknowledging that. And as Meggen said, we're sort of back to connection, and as she and I were talking before this panel started, it's sort of nice to be able to be here together and sort of pause and talk about sort of the human connection, the human elements, alongside all these other great technology innovation things we're talking. It all has to work together so that we can be successful. We can model for our employees, for our communities, for our patients, for our members. And I just want to say thank you to HitLab for this panel and for allowing us to be part of it. And thank you, Amy.
Well, it kind of reminds me of the airline example where you've got to put your oxygen mask on first before you can help anybody else. And we're only as good, our organizations are only as good as the people who are a part of them, and we have to take care of them first. So I love what everyone's been saying, listening to the employees and using their voice to help us advance innovation, whether it is in the traditional space, in the human space, or in the technology space. So thank you all so much, and I agree, it's nice to have a slightly different conversation, not just focusing on the technology, so thank you.